And that concludes voting time, but it doesn't bring our work to an end. But before some members leave, may I wish you all a very Merry Christmas, and I will see you all next year. Thank you. We will now move to the short debate, which is to be introduced by Hefin David. And when members have left the chamber,
leave quietly, then Hefin David can commence his short debate on the topic that he has chosen.
I don't want the clock to start ticking yet. Say when.
The clock can start ticking now. Hefin David.
Diolch, Llywydd, and it's a pleasure and an honour to give a minute of my debate today time to Rhun ap Iorwerth, who together we co-chaired the long COVID cross-party group and worked very effectively together on that on a cross-party basis, and also a minute to Peter Fox of the Conservatives, who will contribute. One of the things that we need to recognise is that those words that we used throughout the pandemic, COVID has not gone away. COVID has not gone away. Well, still, today, COVID has not gone away. People are still falling ill from it, and though we've come a long way, the World Health Organization recognises that the extent of COVID-19 affecting people is still out there, although vaccines have afforded, of course, the majority of the population a considerable degree of protection. But those people who were affected by long COVID during the pandemic, many of them are still being affected by long COVID today. And I'm glad to see that Gareth Ianto Evans from the long COVID group is here to witness the debate today. He has been instrumental in keeping long COVID on the agenda. The World Health Organization defines long COVID as the continuation or development of new symptoms 3 months after the initial infection, with these symptoms lasting for at least 2 months, with no other explanation. While common symptoms of long COVID can include fatigue, shortness of breath and cognitive dysfunction, over 200 symptoms have been reported and can have an impact on everyday functioning. Now, if you've met anyone who suffered from long COVID, I met Lee David Bowen, who's an opera singer in my constituency. I'm glad to say he's back now, singing, and very successfully so. He's been in the West End, but when I met him, he was a shadow of that person. The effect that it had on his body, on his voice, on his brain, was tragic to see. And though he has made what can only ever, we feel, be a partial recovery, we have seen that recovery happen. But Gareth Ianto Evans has made sure that we know of these people. On the 17th of July, Long COVID Support held a lobby event here in the Senedd, where members from different parties met constituents affected. Peter Fox did, I know, Rhun did. And we were interested to hear what more we can do to improve those services for them. And then on the 19th of November, they held an event in the Farchnad, in the Oriel. And it was encouraging to see so many members engaging with them. And today I'm wearing my long COVID pin badge, which shows our support for that group. We wanted to look at what we want to see happen. So I'd say to the Cabinet Secretary, what I'm going to do is ask a few questions. And I'd like, in your response, perhaps rip up the civil service brief and just answer some of the questions that I've got for you today. Some of the questions I'm going to ask you. The first of these is on surveillance. It's difficult to appreciate the full impact and scale of long COVID because of the lack of data. A survey in March suggested 3.3% of the population of England and Scotland are living with the condition, but Wales didn't take part in the survey. Why not? If we were to use that data to extrapolate similar numbers for Wales, it would equate to at least 100,000 people, including 4,500 children. And this is likely to underestimate the true scale of the problem. So my first question to you, Cabinet Secretary, which I'd like you to answer is, will you call for a COVID infection study to help understand the prevalence of long COVID in Wales? The other issue is public health messaging. We can't pretend that COVID-19 is no longer a threat at all. Every COVID infection increases your chance of developing long COVID, and you're at risk regardless of your age, your health or your vaccination level. Each COVID-19 infection could potentially cause cumulative damage to your organs. It is not the case that we develop permanent immunity to each COVID infection. And as people with long COVID are not necessarily classed as clinically vulnerable, many are not eligible for booster jabs. So my question to the Cabinet Secretary is, will the Cabinet Secretary commission a public health campaign highlighting the dangers of repeated COVID infections and the potential for developing long COVID? And it is an issue of prevention. The most effective way to prevent long COVID is not to get COVID-19 in the first place. But for the week ending the 1st of December, 72% of hospital cases of COVID-19 were caught while the patient was already in hospital. So my question to the Cabinet Secretary on this one is, will the Cabinet Secretary consider preventative measures in healthcare settings to guard against so-called quademic of airborne viruses? I want to talk about healthcare workers. The latest module of the UK COVID inquiry highlighted the devastating impact the pandemic had on our frontline health and social care workforce, many who caught COVID while at work and have since developed long COVID and are now unable to work with little in the way of support. So my next question to the Cabinet Secretary is, as well as ensuring preventative measures are put in place to protect staff and patients, will the Cabinet Secretary make provisions to collect data on the incidence and impact of long COVID amongst healthcare workers, with support provided to those who cannot work and those who want to gradually return to work? And on long COVID services, the Welsh Government allocates 8.3 million of the current recurrent funding to the Adferiad programme, with health boards then providing those services locally. Treatment centred around physiotherapy, occupational therapy and counselling. And while there is certainly a place for these interventions alone are insufficient to completely rehabilitate patients. In some cases, patients are being prescribed with exercise which can cause long-term harm. They are harming themselves through undertaking exercise which is prescribed. An evaluation commissioned by the Welsh Government in 2022 praised the service but failed to capture the discontent felt by many patients regarding the lack of appropriate tests and treatments available. There does not appear to be consensus among health boards regarding those tests and treatments that may best serve long COVID patients. Mostly it appears health boards to be working independently of each other, with no sharing of knowledge and little in the way of patient involvement. I've met with the Iorwerth and Bevan Health Board. I imagine Rhun up Iorwerth has met with the health board in his area to discuss these things. And in each case, we find different things happening in different places. Where those with suspected long COVID attend their local GP surgeries, patient advocacy groups report instances where GPs are unaware of how to diagnose or treat long COVID. Presenting at a GP surgery may not be the solution that you are looking for because of those difficulties. Will the Cabinet Secretary therefore commit to reviewing the current service model, with consideration being given to a more directive approach regarding those tests and treatments that are based on the current research and are best suited to the needs of long COVID patients? Getting a more collaborative approach to health boards is important. The Cabinet Secretary should consider developing a national strategic clinical network for long COVID and create a quality statement towards which health boards are accountable. And we should be also considering within that the importance of paediatric services. Future pandemic preparedness. Well, we should not forget the real possibility of a future pandemic. As recommended by the UK COVID inquiry, we must learn the lessons from the last 5 years to ensure that the health systems in Wales are robust and well prepared for future eventualities. Furthermore, it's disappointing that Wales does not have a national strategy and service to consider issues such as fibromyalgia and ME/CFS. Will the Cabinet Secretary therefore consider setting up a statutory health organisation responsible for the prevention, testing and treatment of post-viral illnesses such as long COVID and ME/CFS? These asks were set out in a letter from long COVID support members to their Senedd members in July. Members will have seen them. The Cabinet Secretary recently responded in his letter to this letter in another letter to Nick Thomas-Symonds MP, in which he set out the Welsh Government's position and what action it is currently taking. The purpose of this debate today is to interrogate the Cabinet Secretary's response to that letter and reminding the Welsh Government that people in Wales living with long COVID do not think enough is being done to help them. I've been provided by long COVID support some impact statements from people who've suffered as a result. A friend of mine contacted me on Facebook Messenger just the other day. She said I could use her story. She said, "We feel like a forgotten group, and it will hopefully get people realising the devastation it causes. People think that COVID is a thing of the past, but I've suffered since being hospitalised with COVID in March 2020. Frontline workers, teachers, NHS staff and carers have been particularly hit by this, many losing their careers and income. We were not protected. Many are being refused ill health retirement as permanence of the condition cannot be proved. I have had to give up my career as a college lecturer as chronic fatigue, brain fog, dysphasia meant I could no longer teach despite reducing my hours. A health worker in Chepstow wrote to me and she said, I made the difficult decision to apply for ill health retirement for the NHS in December 2023. This involved collecting a huge folder of evidence to support my application. This process was exhausting. The NHS has lost an experienced senior doctor and researcher. I'm one of many healthcare workers who caught COVID in the workplace and have a permanent disability and have lost their jobs. A student at Swansea University wrote and said, I'm 19 years old and was diagnosed with long COVID in December 2021. Now I'm a second-year student at Swansea University. The fact I'm there at all is because at the very beginning I made a promise to myself that I would not allow long COVID to bring me down and I would not allow myself to be defined by my illness. It is not an easy promise to keep. Every day my symptoms are different. Some days I suffer crippling headaches. I can't even lift my head off the pillow. And a carer from Penarth who looks after their child who has long COVID said, the NHS paediatrician doesn't understand the seriousness of long COVID. They say she should be in school, that psychology will help her walk again. Physiology would help her walking. Over the last 3 years, we've paid thousands of pounds on private doctors, blood tests and prescriptions. But due to her young age, our daughter lives in constant pain and cannot have suitable painkillers, so has to manage with chronic debilitating pain that never goes away. And finally, my last witness statement. A healthcare worker in the Rhun Valley said, I've contracted COVID early 2020. Over the next 2 years, I struggled with multiple symptoms until I had no choice but to retire early as I was unable, due to the condition, to sustain my role. I now see long COVID services being closed within my health board and limited support nationally for individuals with long COVID. There needs to be a national strategy and standards set to all health boards and local authorities to sign up to that will support individuals like me. A petition has been recently submitted to the Senedd on this, calling for a care society focusing on the 3 areas of health, economic participation and physical infrastructure to tackle the crisis of long COVID. And they are now due to be considered by the Senedd's Petitions Committee and may well be debated in the Chamber. But my thanks go to those people who are suffering from long COVID. My thanks go to those members who have engaged with this issue, particularly, as we will see today, Rhun and Peter. And my thanks go to Gareth Ianto Evans for advocating not just for himself as a sufferer of long COVID, but also all of those people that he has met and that we met one sunny day in July on the balcony by the coffee shop in the Senedd and spoke to those people who have very real lifelong effects as a result of suffering from long COVID. They need to be helped. I've set out some ideas as how that might happen, and I look forward to the Cabinet Secretary's response in how they may be addressed.
Iorwerth. Diolch very much, Dibyllywydd, and I'd like to thank those who have suffered for so long, many of them from long COVID, for continuing to battle, and I'm very grateful to Hefin David for bringing this debate to the Senedd today and for being able to co-chair the cross-party group here in the Senedd on long COVID. It's so important, isn't it, that the government responds effectively to the situation that continues nearly 5 years after the virus struck us. There's one constituent of mine, even though I've spoken to so many, there's one constituent that is always in my mind who was a physiotherapist and got COVID in the first few months as part of her work, having to battle to keep her pay and had to leave work in the end, and her heart is still a problem. And chronic fatigue. She was a very fit woman who couldn't do what she's always loved to do, and what people like her try to do is look to the government to act. And I do approve many of the ideas that Hefin David has presented today. They want to see the government encouraging an NHS that listens to the reality about the suffering that continues and gives the support to people as they adjust their lives and face the challenges daily and look for support and improvement. And maybe years have passed since the virus struck us, but the pandemic continues for so many people, and they're looking to the government to ensure that they do realise that.
Diolch, Deputy Llywydd. Can I thank you, Hefin, for securing this debate today? It's really important. Can I also welcome Gareth here as well and thank him for all the work he has done. And I've had the pleasure of meeting him and other constituents who have suffered and are suffering. And my heart goes out to them because it is so debilitating and people don't realise it. The COVID-19 pandemic was just a seismic event that continues to impact those who are suffering. And most of us, we went through COVID and we felt well afterward, but for many, clearly, that isn't the case, and the symptoms last longer and longer. It can impact their daily life so much, as Hevin's already described. And it affects their ability to work, to return to work, even though they really want to, but they just, struggle to. It was interesting, having touched on health workers, and in July 2023, we know the BMA published a report looking at the impact of COVID-19 on doctors. The findings, based on a survey of 600 doctors experienced the long-term effects of COVID, highlighted the significant personal and professional impact of long COVID, with notably 18% of survey respondents reporting that they were left unable to work and others having to reduce their working and training hours. This means that there's been a reduction in expertise within the NHS and medical sectors, with doctors and other medical professionals no longer able to work or to train as a result of the condition. Now, while it is apparent that some medical professionals are unfortunately unable to return to work, it is apparent that they can still offer their vast expertise and lived experiences. It is vital that we as a country can find ways to ensure this crucial group of people are not just supported, but are still able to contribute to a field that needs their expertise. So, Cabinet Secretary, can I please ask that what support is available from the Welsh Government to ensure that those medical professionals who can no longer return to work are assisted? And can I also ask if there will be opportunities or ways for those impacted by long COVID and no longer able to work to still be able to offer their skills and expertise to our health sector? And I concur with all of the questions Hefin put to you also, Cabinet Secretary.
I call on the Cabinet Secretary for Health and Social Care to reply to the debate. Jeremy Miles.
And I welcome the opportunity to provide an update about our continued support for people with long COVID. The World Health Organization, as we have heard, defines long COVID as unexplained symptoms lasting for at least 2 months and present at least 3 months following COVID infection. As we know, it affects multiple systems within the body, including respiratory, cardiovascular, neurological, endocrine and gastrointestinal systems. It can be unpredictable and it can vary in duration and severity. Long COVID is not a single condition. It can be different for each person and presents with clusters of symptoms, often overlapping, which can fluctuate and change over time. Long COVID is complex, manifesting in many ways, and can be difficult to diagnose. More than 200 different symptoms have been reported to date, and it can have a profound impact on a person's quality of life. We also know, as has been referred to already, that the impacts of long COVID go beyond physical symptoms. It can also have a profound impact on people's emotional well-being and mental health, their ability to thrive economically and socially, and can be distressing for families and loved ones. There is no definitive test to diagnose long COVID. Before a diagnosis is made, the National Institute for Health and Care Excellence recommends assessment using a holistic, person-centred approach to rule out other serious complications of COVID-19 and other alternative diagnoses. It also recommends that tests and investigations should be offered based on the individual's symptoms. There are currently no known effective treatments to cure long COVID, although research into potential treatments is ongoing. This means that the NICE guidance focuses on self-management and rehabilitation for those affected. On the question of data, the Office for National Statistics Infection Survey suggested that could be as many as 94,000 people in Wales with long COVID, although definitive figures anywhere on the incidence and prevalence of long COVID are challenging to obtain, partly for some of the reasons I've already given. There was an increased prevalence of self-reported symptoms amongst women, and the highest number of people reporting long COVID were aged 50 to 69. As Hefin David pointed out very powerfully, COVID-19 hasn't gone away. We are still experiencing waves of infection and new variants of the virus. This means, of course, that people are also continuing to develop long COVID. We recognise the need for extra rehabilitation services for people who've been affected by COVID-19 as early as spring 2020. Today, with the end of the emergency phase of the pandemic more than 2 years ago, we continue to support people with long COVID. We've done this by expanding primary and community-based services so the care people with long COVID need is close to where they live. We invested £10 million between 2021 and 2023 through our Adferiad programme to set up these services, and we've since expanded on that, increasing the annual Health Board funding to £8 million a year. Our support for people with long COVID needs to be tailored to meet their specific needs. All health boards have developed multi-professional rehabilitation models of care, underpinned by supported self-care with referral pathways to secondary care when needed. Given our population size and the likely level of demand, it was felt that local services, supported by access to the necessary specialist services when required, was in fact the right model to improve quality of life outcomes for people affected by long COVID. But our delivery model will continue to be informed by the evidence as it emerges and evolves, as well as by those with lived experience. Many of the testimony of some of them have been referred to already in the debate today. We do expect health boards, of course, to continue to support people with long COVID, and with the additional investment to widen access to Adferiad-funded services to people with other conditions but similar diagnostic, rehabilitation and recovery needs. And this includes people referred to in Hefin David's speech, people with ME, chronic fatigue syndrome and fibromyalgia. The key to reducing the number of people who develop long COVID lies, of course, in preventing the number of people who develop COVID-19. Population immunity continues to increase, with many people having hybrid immunity acquired through a combination of vaccination and recovery from natural infection. The evidence to date suggests that vaccines may provide some protection against and reduce the number of new cases of long COVID. Through our winter vaccination programme, we have encouraged and continue to encourage all those eligible to take up the offer of vaccination for both COVID-19 and seasonal flu this winter. We will continue to focus on this important consequence of the pandemic and to work with the NHS to meet people's individual needs.
Up to you. Could you just finish?
I've completed my speech, but I'm happy to hear from the member.
On that final point, people with long COVID aren't considered clinically vulnerable, so they can't easily access vaccines. I think, Hefin, you might have pointed to that in your contribution. So can you make it easier for people with long COVID to access vaccines when the season comes around?
Certainly, we do keep under review, obviously, eligibility for COVID vaccination, and we do seek to reflect emerging evidence as it appears. So it's the point the member makes is important. It's the kind of point that we do keep under review each year as we look at the eligibility criteria for COVID-19 vaccinations across the UK.
Thank you, Cabinet Secretary, and thank you, Hefin David, and that brings today's proceedings and hopefully this year's proceedings to a close.